Well, it's no secret that anxiety is a top concern for parents today. We've tackled it head on in previous episodes, from exploring its potential link to social media to recognizing the signs and equipping ourselves as savvy parent. But there's a vital aspect we haven't delved into enough: the pivotal role of the family in addressing anxiety and other mental health challenges in our kids. Well, today we're shifting gears to zero in on the powerhouse that is the family unit when it comes to our children's well-being. My guest is Dr. Stephen Whiteside, author of Mayo Clinic Anxiety Coach, a parent's guide to treating childhood anxiety and OCD. Available now for pre-order and releasing on April 16th. We'll be tackling common questions parents have, such as who are the best people to help coach kids through their fears, when families should meet with a mental health professional, and how anxiety disorders differ from everyday worries, among others. Welcome to Parenting Great Kids, Dr. Whiteside. I'm so excited to have you here. The show is just for me.
Thank you. I'm excited to be here as well. Thank you so much for having me.
You bet. So you've written other books before, but this book is really directed towards parents. You said you've written books for therapists, but this is for parents. And so I think you're going to sell millions and millions of copies because parents really need a lot of help. Now, you are a board-certified clinical psychologist, professor of psychology at Mayo Clinic, and director of pediatric anxiety disorders at Mayo Clinic. How often do you treat kids, and how often do you just teach psychologists how to treat kids?
My primary role is a clinician.
Mm-hmm.
So that is my day job. That is what I'm supposed to do most days. So I work with kids and their parents who are dealing with anxiety and obsessive compulsive disorder, OCD, most days of the week.
Awesome. So you're not just an academic person. You are a hands-on, I understand your kids, let's go and deal with this. What prompted you to write about coaching kids through anxiety?
Yeah, there's probably a few kind of directions led us to that. So first, there are a couple of things that make our approach to childhood anxiety disorders and OCD a little bit different than others. And one of them is that we work with kids and parents together the entire time.
Mm-hmm.
Of course, we will meet with them individually here and there as needed to talk about things that are sensitive or just need to be addressed. But in general, we are working with them together the whole time.
Mm-hmm.
And then the second piece that makes what we do a little bit differently is we really focus on experience, helping kids face their fears, do what's called exposure therapy, so that they learn through their own experience that what they're afraid of probably won't happen and they can handle feeling anxious. So based on that experience, day in and day out for probably unfortunately, probably more than 20 years now, I have seen parents and kids learn to be exposure experts. So writing a book to teach parents to be exposure coaches was very consistent with the model of how we've been working with families for years.
So I love, the approach of desensitizing kids, but let's back up a little bit. First of all, as a pediatrician, I'm kind of the gateway. A lot of times parents will come to me before they come to you, because they'll come to me saying, I have a 7-year-old, I have a 13-year-old, and I'm concerned that they're worried all the time. I'm concerned they may have anxiety. Pretend you're me and you're talking to a parent, and I have to figure out whether or not that child has anxiety. What kind of questions should I ask, and what should parents be looking for in their kids?
Yeah, that's a great question. And that's where we start the book with. The first section is, what is an anxiety disorder? And when do you know that it's time to get help? Because if we don't accurately understand a child's experience and what they're going through, if we're wrong, then we're probably going to recommend the wrong treatment. And that's not only not going to be helpful, but it's going to be frustrating and make it less likely that the family's going to seek help again if they've had a negative experience. So it's really important to get off on the right track. So it begins with kind of a shared understanding of what an anxiety disorder is. And that's simply kids feeling more nervous, worried, or afraid than we would expect in a situation. And so we want to separate that from a couple things. First is stress. Some kids are anxious and worried because life is stressful. There's a lot of arguing at home, or they're being bullied at school, or they're failing their classes. And we would expect most kids to be anxious and nervous in that situation. So that's different. We need to help them solve that problem. An anxiety disorder is when things are going smoothly. Parents are healthy and doing well, but the child is still worried about their well-being and whether the family is going to stay together.
Mm-hmm.
Kids are well liked at school, but they're so shy and nervous that they're afraid they're going to make mistakes. They get very nervous talking to people. Or they're getting A's, but they're still always worried that they're not doing well enough. So the child is worrying more than they need to. So that's the first piece of whether or not it's an anxiety disorder. And then the second piece is simply, is it causing problems?
Mm-hmm.
Is fear and worry making life difficult for the child or the parents? Because parents are very important in kids' lives.
Mm-hmm.
So is it getting in the way of social interactions, doing things with the family, being successful in school? And if it is, then it's probably enough of a problem that we should work on it.
Mm-hmm. But what if it isn't? What if you got a kid who's functioning fairly well and they're covering up pretty well, but they feel they've just kind of got this motor going on underneath where they have to get good grades and they have to be the best at everything and they have to, they're afraid of letting people down. Now they're functioning well. And usually I find this in teenagers who can articulate this. Sometimes a younger kid can't articulate it, but they feel like something is propelling them forward and they're anxious all the time and they don't know what to do. How do you know if that's an anxiety disorder or just a personality in a kid?
Yeah. Yeah, and that's a very good, I'm glad you brought that up. That's really important because just the technical definition of an anxiety disorder or mental health problems are one, that it causes problems, or two, that it's really distressful and upsetting.
Mm-hmm.
So, and especially with anxiety where kids are nervous about things, so they're working very hard to make sure that no mistakes happen. That distress piece can be really important. But oftentimes when we peek beneath the hood, we see that there is some interference. So they're very nervous and worried about making sure that their grades are good enough, that they don't disappoint people. And yes, they're functioning, but they're not really sleeping enough because they're spending way too much time at night doing homework. They're not doing relaxation activities. They're not hanging out because they're so worried about being good enough. So we can see that there's problems in other areas, even if those problems are not having enough time to socialize and just relax and have downtime.
Mm-hmm.
And so part of it comes with, talking with it. It doesn't all have to be solved at the beginning. That's one of the nice things about exposure therapy and behavior therapy in general, is that the side effects are mostly that it's sort of hard work and takes some time. But they're kind of the things that you learn in therapy to take small steps and to stick with things even though they're hard and do things that are challenging. Life lessons for all of us. So the downsides of starting therapy are pretty low. And if you get started and it seems pretty clear that this child's focus on being successful is really consistent with who they are and they don't see it as a problem, and the parents are just wanting to check things out and they think the child's doing fine, then we don't have to do anything about it. But now they know that we exist.
Yeah.
And if down the line it slips into being more problematic or distressing, it's easier to find us and get back in.
Awesome. So what I'm taking away from what you're saying is that there are different groups of anxiety issues in kids. I've seen, for instance, kids who are going along fine and then COVID hit and now they're a mess. And then there are kids who, ever since they were quite young, are acting like the kids you and I've just been talking about, the kids with a sort of motor, and I just have to. And then there are the kids who just have these sort of panic attacks, and then they're better, and then they have these panic attacks. So how do you separate out the kids with anxiety and when they need treatment and when they don't need treatment? And then is the treatment for each of them the same? So
when we meet with families for the first time, our first goal is to decide with the family, the child and the parents, is what the child experiencing best described as an anxiety disorder? And again, that means being more nervous, worried, or afraid of than we would expect them to be, of everyday activities and circumstances. The second step is then being more precise with the diagnosis. And the reason we go in that order is because, fortunately, we treat all anxiety disorders the same, including OCD. So there's a lot of overlap between them. So if you have one anxiety disorder, you probably have more than one. And that's not particularly helpful to be given a bunch of different labels for kind of one issue that you're dealing with. So we try to make families aware of that don't worry if you have social anxiety and generalized anxiety disorder. It's all different versions of the same thing. We'll treat it all the same.
Mm-hmm.
Fears and worries tend to change over development. So what we see, in younger kids is frequently separation anxiety. So they're very nervous about separating from parents at nighttime for going to bed or to go to school, and specific fears such as fears of animals, fears of the dark. And then as kids get older and social interactions start to be more important, later elementary school, getting into middle school, then we start to see more kids with social anxiety disorder, very nervous about talking to other kids. And then as they begin to be teenagers and start having more of ability to think about and worry about the future and worry about all the things they need to handle, then generalized anxiety disorder, where kids are just worrying very frequently about lots of different topics to the point that it makes them feel bad physically, becomes more prevalent.
So in diagnosing and treating anxiety disorders, it seems like you start out pretty broad. The kids will come to me, they're nervous and worried, maybe have the motor running and so forth. And then I say, okay, it's time to go to a psychologist and figure this out. So I love that you say that it's critical to get an accurate diagnosis, because anxiety, other things can sort of mask as anxiety, or anxiety can be a result of something else. If you've got, you're being bullied, or you've got depression, or something else is going on, or learning issue, when you can't understand what's going on at school, you have anxiety because of that. So then you decide, okay, is it anxiety? And then where does it fall? Is it generalized? Do you have specific phobias? Is it separation anxiety? And at that point, is that where someone might, like you, would sort of untangle things and say, this is specifically what we're worried, what we're dealing with, and now let's go down the path of treating that? Or can you start kind of not knowing exactly where the anxiety is coming from?
So I think one of the answers is everything that I do as a child psychologist when it comes to anxiety and OCD is it's pretty straightforward. And our goal is to describe things and present things in a way that kids as young as 7 can understand and their parents can understand. And yes, I've been doing this for a long time, and it takes expertise and experience. But our general thought is, yeah, most families can learn how to do this. And so part of the inspiration for writing the book is there's probably a lot of families out there who anxiety is a mild problem, and that if they have some direction and some permission and some reassurance that these are the right things to do, they can probably work through this on their own, identifying it, sorting it out, and making a plan. But there are a lot of families, probably with more severe anxiety or OCD, a book is probably not going to be enough. A self-help app is probably not going to be enough. You just simply need somebody who has done this time and time again and feels confident and can help you sort through it, plan it, and follow through with your treatment plan. And hopefully this book will educate families like, oh, I know what I need to look for. So if I go to a therapist and they're not doing what I'm looking for, now I know that I need to probably go look someplace else.
Well, and that's a great point because, again, you can get the diagnosis right. You can have, say my child is in 6th grade. They have a social phobia. They go to school. They're scared. They sweat. They can't focus. They don't want to go to school anymore. And if you don't get them to a therapist who knows how to treat phobias and anxiety, you can waste 6 months. And I've seen that happen. And it's so frustrating. And then the kid doesn't want to get help anymore. So let's talk about that kid. 6th grade, doing fine in school. All of a sudden starts a new year. He's a month in and he's not wanting to go to school. Everybody hates him. They all stare at him. He's scared. And parents are noticing that he just is kind of miserable and doesn't want to go to school. pick it up from there. What would that kid lands in your office with the parents? Where do you start, and where do you, how do you treat them?
Yeah. We ask them as a family, tell me about what brings you in, assuming that parents are going to start things off. Kids very rarely, if ever, say, you know what, I think I need to go to talk to a psychologist.
Well, no.
Parents see the problem.
Exactly, yeah.
Parents initiate things. So we start with the parents and get a general sense. And then start with just some breaking the ice questions with kids, and then ask them for their perspective. And for the most part, kids are appropriately insightful and invested and are able to answer these questions. And, some kids are older and younger, and some kids can give us more details than others. But some of the things that we're wanting to know is, so this fear of going to school in this example is new, but is it new because it's just more extreme? Like every beginning of year is hard, new activities. He's always been sort of shy, but now it's become problematic. Then that sort of helps us feel more confident that we need to work on social anxiety, as opposed to, oh, he's always been the life of the party. Now all of a sudden he's totally anxious. Still could be an anxiety disorder, this transition to a bigger group of kids in middle school or what have you. But also we want to make sure that we're looking at other things. Are there some peer problems that are leading to this anxiety? We often ask kids, what are you nervous about? They say school. I say, okay, yeah. What at school? Just school. Oh, that's fine. What about your teachers? Your teachers make you nervous? No. Schoolwork? Is the schoolwork hard? No, that's pretty easy. What about the other kids? Oh yeah, I hate having to talk in class. And so just kind of questions like that to figure out what is it that's hard for them. That kind of guides us to identifying the situations and activities that make them anxious. And that leads to diagnosing social anxiety because it's interacting with peers versus general anxiety because they're worried about schoolwork. And that label, that diagnosis directs us to making a treatment plan to help them break those fears down and practice facing their fears.
So you help them pinpoint it. Okay, you are afraid of these two kids, or you're afraid of going into the lunchroom and having to sit alone. So you pinpoint it. Then what do you do? Do you make him go and sit in the cafeteria alone day after day and gut it out? Or how do you, once they identify the fear, how do you get them past that?
So to help make that plan of what they need to do to face their fears, to help, so to make that bridge from, okay, now we've got this label, this category, this diagnosis of social anxiety. What does that mean specifically for what I need to do? And so it kind of in that first section of the book where we're learning about anxiety disorders, the next step is taking their experience and putting it to the avoidance cycle. So what specifically sets off the anxiety? Is it giving presentations, or is it more informally having to find someone to talk to in the hallway or sit with at lunch? And it's an anxiety disorder, so these are situations that most kids can handle. So what does this child expect to happen that makes it scary? That people are going to judge me, I'm going to make mistakes. What are the thoughts, the fears they have that make these safe situations scary? And then we look at, well, what have you been doing to avoid? So sometimes it's like, I completely avoid. I don't join extracurricular activities. I'd love to play soccer, but I don't because I'm too nervous. And I'd like to avoid school, but my parents won't let me. So I just keep my head down. I don't talk. I avoid situations where there's chit chat going. And so we identify that avoidance that keeps the fear around. And it's that plan that sets us up to help them face their fears.
Can an 8-year-old identify that? I'm thinking of, the 6th grader, 7th grader, 8th grader. In my experience, you're right. They'll tell you, they talk. If you push them, they'll say, I'm afraid of this person, or I'm afraid of this kind of thing. But if you have a 7-year-old or an 8-year-old, and they don't want to go to school, and there's some avoidance behavior, can they articulate what they're avoiding, and can they articulate what they're afraid of?
It depends. It depends. Younger kids, it's more difficult. All kids develop at different ages or at different trajectories. But that kind of goes back to why we are working with kids and parents together. Because I agree with you. I think it would be sort of ridiculous for me to sit with an 8-year-old for an hour and figure out what they're afraid of, and then bring the parents in and tell them. That's not going to go very well. So this process is kids and parents working together. And most parents really let their kids lead. And so when we're doing this, we do it. We do most of our treatment in groups because it allows us to get people in quickly. It's also makes people nervous at first, but it's very comforting and normalizing to see here a bunch of other normal people going through a similar situation as us. And if you're working on social anxiety, it's pretty handy to have a bunch of kids around to practice talking to.
Yeah.
But in those groups, I say, here, we've got this binder here. Let's, we'll go through this step by step, fill it out. I don't care who writes. It's great if kids write. If parents, it's more efficient for you to do. And parents, for the vast majority of the time, have their kids take the lead. And so there's, especially with all fears, partly, what are you afraid is going to happen? People will laugh at me. But sometimes there's not a specific fear. It's just, I don't know. I just can't handle it. OCD is a great example. Some people are afraid if I touch a doorknob, I'll get germs and that I'll get sick and I'll die. So I have to wash it off. Other people say, it's just gross. If I touch something other people have touched, I'll have grossness all over me. I know it's not going to hurt me, but I can't handle it. It's too gross. I have to wash it off. And so we apply that to all fear. Sometimes I'm nervous talking to people. I know they're not going to start yelling at me, but it just makes me nervous. So it's easier to avoid. And so that's a very reasonable expectation. I think it'll be too hard. I can't handle it, or I can't handle it alone. In between, what specifically do you think will happen, or it's just too overwhelming? Pretty much all kids and parents can come up with some reasonable expectation. And it's helpful because when we do exposures, when we face their fears, we're setting them up to test those beliefs. So do people actually laugh at you when you stumble over your words? Does your anxiety keep building and building and building even when you're asking questions, or does it actually start to go down and become more manageable with practice? Those are the hypotheses. Those are the experiments that we're testing when we help kids face their fears.
So in involving parents, because this is a big, important part of what you do you keep parents involved from the beginning to the end? Like, okay, I'm going to help your child identify what they're afraid of. Then I'm going to help them through this. Is there a point where you just go it alone with the kids, or do you keep parents involved the whole way along, with like exposure therapy and everything?
Yeah, the whole way. So, the parent, as we talked about before, the parents are the ones bringing them in. So the parents are usually the ones starting the process off by making the appointment and explaining to us why their child's here. We just talked about how the parents and kids are learning about how anxiety works and applying that model to their experience. They then learn how to set up, do, and end exposures together. And then our treatment sessions are parents and kids doing exposures in the session with less and less hands-on assistance from us. And so we set it up from the beginning is that the goal is, it starts with us. It is not fair for me as a therapist to say, hey, you go and do exposures on your own. It'll work. Trust me. We have to do them in the appointment. So that's why it's great to have groups. So they will practice asking questions or presenting in front of other group members, or we leave the office and they go, ask for questions they ask questions at the desk, or go around and touch germs, or sit in a room in the dark to practice separation from their parents. And then, so they learn together. Kids learn they can handle it. Parents learn that their kids can handle it. That's step one. Step two is kids and parents doing this on their own between appointments. And step three is kids doing it eventually independently.
Yeah.
But they're not going to get there unless we help them in the session and parents help them between sessions. Yeah. So we're working together the whole time.
From watching exposure therapy and therapists who have done this with kids, it's very hard. It's hard for me to see kids doing things like standing in elevators, or learning if they have a cleanliness phobia, learning to eat something with a little bit of dirt on it or whatever. What are the issues that parents face, or blocks that parents may face in helping their kids during exposure therapy?
I like to, somewhat tongue-in-cheek, or maybe this is just very self-serving because I am a parent as well. We have a 5-day intensive treatment where we kind of smush this all into 5 days. And we've got one time where parents meet separately from the kids, and we just talk about how to get along when we don't see eye to eye on our plans. And with the parents, I will somewhat jokingly say, the kids, they're working hard. They're facing their fears. But it is like doubly hard for us as parents, because we are not only facing our own anxiety about our child not being successful, but also just the terrible feeling of my child is uncomfortable and upset, and I could fix it, but I'm not allowed to. Because as parents, we very appropriately love helping our kids feel better. We love fixing things for our kids. That is a very rewarding experience. And when you're coaching your child through exposure, you just can't do it. And that is a rotten experience.
Yeah.
So parents are learning in the session that they can successfully do this so that they leave feeling more confident they can keep doing it at home.
And they need support. Like you said,
Oh, yeah.
They need support too, and going through this. So what are the common mistakes that parents make from beginning to end in dealing with their kids with anxiety? Maybe mom and dad will come in, 10-year-olds having anxiety about, a bully at school or soccer or whatever. And mom goes, I'm really kind of worried about, I don't want to stereotype here. This is just my experience. Mom will go, I'm just really worried about that. And dad says, oh, you know what? He's just oversensitive. You need to just deal with it and move on. What are some of them? I see that as a mistake, but what are some of the common mistakes that you see can trip parents up along the way?
And what you just described right there pretty much sums it up. And it's important to make it clear. And I know you don't mean this, but coming from me, I have to be very sensitive about these things. They're not really. I'm a parent myself. We make tons of mistakes.
Of
That's
course,
normal parenting.
yeah.
We make tons of mistakes, and if we didn't, our kids would be very fragile because they wouldn't know how to deal with people who weren't perfect. So making mistakes is a good part of parenting. And so the way parents go off track is either not pushing hard enough in accommodating and doing things for their child, or pushing too hard, or kind of going back and forth between the two of them. Mm-hmm. So, part of what leads to an anxiety disorder is that kids are nervous and they avoid it and they don't learn that they can handle it. And parents very naturally get sucked into that. And so parents, a lot of what they are doing are helping their kids avoid, because they need to keep life going and we need to get to school. We need to get this done. And if it involves me helping my child or doing this or helping them avoid that, that's what we have to do to keep life going, which is fine. But when we're in treatment, we're not focusing on keeping day-to-day life going. We're focusing on what can we do right now that will make things better in the future, while also keeping life going.
And I think there's that balance. You don't want to overread every child's emotion and go, oh, this is a problem. Now they're worried. Now they're going to have anxiety, which I see. And then the other extreme is you just sort of dismiss every feeling and fear and worry they have. I mean, that really doesn't help either. We only have a few minutes left, but I do want to touch down on one thing because this is pretty prevalent. Kids since COVID, kids of all ages I've seen a surge, and I'm sure you have too, in anxiety and depression. Where does the surge in anxiety come from in kids because of COVID and the isolation? What makes them so anxious?
None of us really know. Even before COVID, it was pretty well documented that there's an increase in anxiety and depression. Mm-hmm. So that was already happening. And then with COVID, that disrupted everybody's lives. And we see, like you're describing, we see a number of patients who come in who seemed like they were on the anxious side. Nothing wrong with that. But they were getting by. But then all of a sudden they were isolated for a year or so. And they didn't have peer contact. They were doing school from home. They weren't separating from parents. And then all of a sudden, that's just a lot of avoidance. And then when they had to get back to school, it was just much more frightening. And even though we're a few years out from the isolation, some kids are still struggling to get back in because they are struggling to break those patterns of avoidance. And that has prevented them from kind of building their confidence again. So we see a lot of kids who COVID tripped up and need help catching back up and getting back into the stride.
What about the kids who weren't anxious before? They were healthy, they were fine, and then COVID hit, and all of a sudden they're alone. Is there something about just being alone or loneliness or detachment from friends that triggers anxiety, even if they didn't have an anxiety disorder going in it?
Yeah, unpleasant, traumatic experiences, or even less traumatic but unpleasant, stressful experiences can trigger anxiety, but also can trigger depression. And especially not peer interactions is so important to development, and being isolated from peers can lead to feeling nervous being around them when you get back to them, but also can more immediately lead to feeling down and depressed because you've lost such an important part of your daily life.
So, Dr. Whiteside, you've been talking about exposure therapy. So, what is exposure therapy and how does it work?
Yeah, so that's the essence of what we do. And planned exposures are facing your fears. So you simply set up an experiment for a child to do something that makes them nervous, so that they can learn that what they're afraid was going to happen is probably not going to happen, and that they can handle feeling nervous until they feel better. And when things don't go smoothly, they can handle that too. And so for a child with social anxiety, that might involve starting conversations or giving a presentation in front of the group. OCD is a nice, solid example or clear example. If you're afraid of contamination, you go around and touch public surfaces and rub the germs on you. Separation anxiety, we have kids do things independently. General worry is a little counterintuitive. When kids worry about lots of different things, it's the thought that itself that sets off their anxiety. So we have them repeat scary thoughts until those thoughts get boring. And that's the essence of what we do. And probably the most important thing to keep in mind with planned exposures is that you have to do them repeatedly. Doing it just once and seeing that you live through it is probably not enough. You have to do it again and again and again within that 20, 30-minute period to see, I was terrified the first time, but now I'm bored and I really wish this was done because it's just sort of silly and nothing bad's happening. So that repetition of doing it over and over again is one of the main differences between planned exposures and just dealing with anxiety-provoking situations in everyday life.
I love it. But as a parent, that's very uncomfortable because part of the kid getting over the anxiety is becoming anxious and becoming frightened and getting in that situation where I can't do it. I can't give a talk in front of all these people. Yes, you can. And that's hard for parents to watch because when they face their fears, kids are uncomfortable, which means parents are uncomfortable. But I love what you say. The more you do it and you repeat it, you absolutely can get over anxiety. Is that a correct statement?
Yes. And so we usually talk about learning to manage anxiety because we're all anxious. There's nothing wrong with being anxious. That's a normal part of life. And so we are not getting rid of anxiety. We are lowering it so it's not problematic and building our confidence that we can handle it and do what we want to do. But in terms of being challenging for parents, I agree 100%. And that is why parents are involved in the session, because it's not fair to say, go home and have your child do this. Trust me, it'll work. It worked here. It'll work at home. Parents plan it with their child, watch their child do it, and wrap it up with their child afterwards to learn from it. So parents are like, yeah, I can do this at home because I saw it work here. And I feel confident that my child can handle this, even if they feel anxious at home. We did this together. We can do it again on our own.
Absolutely. And if it rears its head in a couple of years, 5 years, 10 years, parents know, look, you can get over this. You've done it before and we can do it again. Finally, I said I was going to do just one question, but I have one more because I deal with this. Healthy avoidance and anxiety about going to school because of a bully. What do parents do? Ask all the time. My kid doesn't want to go to school. There's a bully in the class. Teachers aren't doing anything. How do you help kids with that?
Yeah. So that, that's a really important question. And that probably goes back to the essence of what an anxiety disorder is and why we have to get them right, the difference. So if it's anxiety disorder, things are going fine socially, but they're nervous and making mistakes. So we have to help them face their fears. We see the difficulty lives within the child. They are more nervous. They need to learn that things are not as bad as their anxiety tells them. With a bully, the problem is not with the child. The problem is occurring in the school setting. The problem is outside the child. Someone is mistreating the child, and that is causing them stress. And most kids would be upset and stressed in that situation. So we don't face our fears. We don't expose ourselves to being bullied.
No.
We, as you put it, healthy avoidance. We need to ideally fix the situation. And bullying is not something that kids themselves can fix. It is something that we as a society, whether that's parents or with younger kids prior to age 4th grade or so, parents can intervene, talk to the school. At older ages, if parents intervene and other kids know that this child's parents intervenes, probably is going to make things worse. but it's the responsibility of parents to teach their kids not to bully. It is the responsibility of schools to set up environments where bullying is not accepted. It's the responsibility of other kids to intervene when kids are bullying. But obviously, with your own child, you can't change all those things. Right. So the things to do with bullying are healthy avoidance. So bullies are more likely to target kids who are perceived as weak or alone. So treating any anxiety so that kids are more confident is helpful. Having kids have one or two friends that they can be with makes it less likely they will be bullied. And if they are bullied, having just one friend who you can talk about how much this stinks is resilient and helpful. Having bullies are more likely to pick on kids when adults are not around. So staying in a situation where there is a teacher supervising makes it less likely to be the target of bullying.
Yep. Well, unfortunately, that might be increasing. I hope not. But, things in classrooms are constantly changing. And I know that's a real big concern for a lot of parents. My guest today has been Dr. Stephen Whiteside. He is the author of Mayo Clinic Anxiety Coach, A Parent's Guide to Treating Childhood Anxiety and OCD. And we didn't even get to talk about OCD. The book is chock full of helps for parents, walking them through, okay, here's how you know anxiety is not just worry, it's something more serious, how to get involved, how to go through a step-by-step program, and then how to find help for your child. And I think it's a really, really important read because there's so many parents who are watching their kids and concerned, about anxiety being developed or anxiety developing in their kids. So Dr. Whiteside, this has been so great. You've taught me a lot. I know you've taught a lot of our parents a lot. I sure appreciate you coming on the program today. Thanks so much.
Thank you so much for having me. It was a real joy.